Hi everybody, we have Fred with us today, and Fred, can you just tell us what it was like and how you were feeling when you came in a couple months ago?
Well, when I came to visit Dr. Combro, I had already been to about 11 doctors' offices, and I was really desperate. I tried everything, and nothing seemed to work, and my mood was down, and I had headaches, I had aches and pains, I had TMJ, so I was not really in good shape. And my first visit was really uplifting because Dr. Combro was willing to take me as a patient, and he had answers. You know, he had several things that he wanted me to try. You know, I had been to some doctors' offices that all they could do was just shake their heads and say, "Oh, this is really complicated," or whatever I asked them, they would say, "It's controversial." You know, I had paid some really hefty doctor's fees just to get reactions like that, complicated.
Fred, what were you diagnosed with?
Well, they told me I had polymyalgia, and but nobody could say how could all of a sudden I developed symptoms like that. 1 week I was fine, and then next week I had aches and pains, and so and Dr. Combro right away, I walked in the office, he said, "It's all in your gut." And that was new to me because I had never heard that kind of description of what could be my problem. And then I started reading about it, and I found out that yes, there is some truth to that, or I found out that that was the case. IBS, inflammatory bowel syndrome, and the supplements that Dr. Combro gave me. At first, I was hesitant because I didn't know what my reaction would be, but as I started taking them, I started feeling better. I found out that yes, I needed vitamin D. I was deficient in vitamin D, and as I started taking the supplements, my strength came back, my headaches was gone, and I just was renewed. His promise was to restore me 75%, and I think he exceeded that, and I feel like I'm almost there where I was, before I had my issues. So I'm very thankful to Dr. Combro. I think he did a great job.
You're so welcome, Fred. Just one more question. Is there a disease that you closely matched that we thought it was?
Well, I think what I learned from this experience was that when you have aches and pains and they say, okay, you have polymyalgia, you have rheumatoid arthritis, these are really symptoms of something else.
Yes.
You have aches and pains not because you have arthritis, but arthritis is a symptom of, your bowel system is not working, you're not digesting the protein correctly, and these are getting ingested into your system, and your body defenses start attacking those proteins because they need to be broken down. And one of the supplements that I got is exactly for that. It has L-glutamine, which is helps IBS and helps ingesting protein. So I think he was right on the mark. I think I'm very thankful to Dr. Combro for having the courage actually to take me as a patient, where many practitioners, doctors just shook their heads. To them it was a big puzzle. And also he introduced me to a book that I bought, Why Can't I Feel Better by Horowitz, and that was very helpful too. I realized that
what was that book about? It was about treating
people with chronic Lyme syndrome,
yes,
and that
yes.
was what I was diagnosed, and I think that matched my symptoms.
Yes.
The
yes.
questionnaire that Dr. Combro gave me, I started filling the questionnaire. I said, "Well, this is what I have." I know I took the Lyme test. The first Lyme test came positive, and after that I took like 5 more, and they came negative. But Lyme is a pretty sneaky bacteria. It could, hide in your system without it being, detected. And my symptoms matched, the clinical evaluation matched Lyme disease, even though lab results were very inconsistent.
Yes.
And I realized that I should, look at the clinical symptoms, which
yes.
I had. And I was treated for those symptoms, and I feel better. I mean, I could hardly bend and pick up something from the floor, I would just be feeling so weak and exhausted. And then last week I was able to carry a bike 8 floors up the condominium.
That's amazing.
Yeah.
That's amazing.
You know, I have done canoeing, I've gone, you know, long bike rides, 8-mile bike ride. So I feel I'm restored, and I'm very thankful.
You're very welcome, Fred. Do you give me permission to use this information to teach other patients and doctors?
Absolutely.
All right, you're welcome. Thank you, Fred.